My name is Stephen McCurdy, and I'm privileged to be the director of the UC Davis MPH program.
Okay, my name is Patrick Romano. I'm a professor in the medical school in the Division of General Internal Medicine and General Pediatrics. I teach in the MPH program both occasionally in lectures for a number of the core courses. I also teach a special course on injury epidemiology, and I advise a number of the MPH students.
I'm Diana Cassidy, and I'm the Associate Director of the Master in Public Health program here at UC Davis.
When I speak with students about the program, my interest really is to help them make a decision that's right for them about where they can best get public health training. And in doing that, therefore, I like to share about what are our strengths and, yes, give them an honest accounting, too, of what are some of our limitations in this program.
People don't realize that policy decisions related to transportation, land use, zoning, alcohol beverage control, healthcare delivery systems, all of these things affect public health. So part of what we try to do in the MPH program is to help students understand these linkages, to help students recognize that the decisions that they make every day as they go about their lives, the decisions that they'll make in their future roles in various policy-making arenas will have a tremendous impact on public health.
Well, I do two things. One is that I teach. So I teach one of the required courses called Social and Behavioral Aspects of Public Health. And that's basically teaching students about health behavior change.
Probably what my favorite part of the program or my activities involves teaching. I just love it. It's a wonderful opportunity to work with students, and you know, in my own experience in public health, I have the sense that I didn't really get it until I was really well along into public health, even into my faculty years. And I would come to these points where I would have this sudden satori, this sudden realization, oh, that's what this is all about. And I asked myself, why didn't somebody tell me that before? So now I, as the director of the program and a teacher in it, have the opportunity to be able to bring those insights to the students so that hopefully cut their time and sweat factors by some measure so that they don't have to wait as long as I did before they finally get it.
My other main responsibility here at the Master in Public Health program at UC Davis is administrative responsibility as the Associate Director. And so I do a lot of work in recruitment and outreach because, of course, we want everyone to know about UC Davis. We're a relatively new program. We were established in 2002, and so we still have some education to do, letting the Central Valley region know, that we exist. And we also want to recruit the best possible student applicant pool.
My name is Rachel Allman, and I'm currently a student in the UC Davis Masters of Public Health program.
My name is Benjamin Hicks, and I'm a student at the Masters of Public Health program at UC Davis.
Hi, my name is Fook, and I am a student in the UC Davis MPH program.
My name is Rupal Patel. I am a student in the Masters in Public Health program. I'm also an internist, and I decided to get an MPH because during my residency program I felt that there wasn't enough attention on prevention, and I really needed more training on those issues.
I came to the Master Public Health program here at Davis because I decided I didn't want to do direct practice in social work anymore. I have a master's in social work also. I wanted to work on a more broad scale, preferably for state government, working on policy, maybe program development. And all the jobs I had been applying to really required a public health master's. So I decided to give it a shot and add another degree to my realm.
I really liked this program because I saw that it would help me work full-time while participating with the program and give me professional experience as I worked with it.
I came to the MPH program because I was involved in several medical activities and organizations back in my undergrad career. And through those organizations and activities, I realized the importance of public health. And through those experiences, I decided to go toward public health.
Well, also another aspect of the program that is phenomenal is the practicum. Gives us a kind of real world experience with incorporating our knowledge that we gain from the coursework into a real life experience.
So the students who come here have this unparalleled opportunity to work with the California Department of Public Health, which has world-class, internationally renowned programs in very important areas of public health. I mean, tobacco is an obvious one. And they, through the course of their practicum, have the opportunity to work shoulder to shoulder, elbow to elbow with the people who are responsible for making the state of California, for example, giving the state of California the second lowest tobacco use rate in the entire nation. I mean, I'm not aware of this opportunity being available at virtually any other MPH program.
What is so exciting about the MPH program is that is all that I'm learning right now. Everything that I'm learning right now relates to my daily activities, and I feel like the more I learn, the more I don't know of everything that's going on around me.
West Nile is named for the West Nile district in Uganda, but you don't hear about problems in Uganda with West Nile virus. It became a problem when lineage 1 clades moved into Europe and then into North America. Right now, anyone, anywhere in the world can be any place else within a couple of days. The idea is a 6-month-long voyage is like Magellan took, is no longer how we get around. So you can be in, go on an eco-tourist trip to Manaus in the Amazon, get bit by a mosquito that has yellow fever virus, and if you refuse vaccination, you can then hop on a plane and go back to San Francisco, come down with yellow fever virus.
One of the things I like most about my job here in the Master in Public Health program is to see students transform over the 12 to 18 months they're here with us. On the first day in August, they're bright, I know that, they're excited, they're interested in public health, and that's all a fabulous foundation, but they can't necessarily do public health. And so over the 9 or 12 months of coursework, they take their epidemiology course, the biostatistics, they take my course in health behavior change, and they also complete a 300-hour practicum. And at the end of that, they're required to present at what we call the MPH Symposium. That's a public presentation of their work. And it's at that moment, somehow, they're suddenly transformed into public health professionals. And at that moment, I'm confident that they can go out into the work world and succeed.
I really enjoy that this program is structured so that you can go as fast or as slow as you'd like. Because I'm already a professional, I really want to kind of get in and out as quickly as possible, but still take quality classes, and I feel like I've been able to do that. I will actually have finished my whole program within 1 year, and that includes doing my practicum.
The program has all different, different types of students. We have medical students, we have doctors, and students who are interested in all different aspects of public health. And so I think that we're a very diverse class, and I don't know, I think everybody brings into the class different experiences, different views, and so I say one word or 2 words I would describe about my colleagues is, I guess, diversity and fun.
My colleagues are extremely supportive. I know in one project within medical statistics, it was just, we were all having problems with one particular problem, and they went ahead and asked the teacher, and more or less we all talked and supported one another and came upon a conclusion, and it was really just well implemented how we solved the problem.
The program sets us up really well. They put us together with graduate advisors with common interests, and And my graduate advisor is so great, such a great resource, and such a great mentor. She helped me with my practicum. She guided me through how the whole program in general, and so I feel really blessed, and I really loved all the faculties here.
Well, I think one thing that I bring to the program specifically is 20 years of experience as a primary care physician, working within a healthcare system and working on ways to improve healthcare delivery in healthcare systems. So what I do in my research every day is really trying to apply principles of public health, principles of epidemiology, and other public health disciplines to improve healthcare. So I try to bring that perspective to my teaching with the MPH students.
My name is Jason Spitzer. I graduated from the Master's in Public Health program in June of 2010, and I've been connected with the campus since then. I now work for the Student Health and Counseling Services as a health educator. I really enjoyed the program as I was going through it. It gave me some even though I've been working in public health for a while, it really felt like it gave me some perspective on the theories behind what I had been doing, and it helped me to expand into different areas. Yeah, I've still maintained some friendships from people that I went through the program with, and that's been really great to sort of compare stories of where people are in their careers and how they're taking what they've learned from this program and what they're doing now. And I still work on campus, so I still keep in touch with a lot of the faculty and the administrative staff who work with the program.
If you want access to top researchers in the field of medicine and vet medicine and vector-borne diseases, you should really consider the UC Davis Master in Public Health program, because you will have direct access to those professionals here.
I think you should enroll in the public health program at UC Davis because it's very supportive and it actually gives you practical experience within the health field, unlike most other programs. It's not just sitting in class, it's you learning what you need to do for your job later on.